So my name is Amy Cassata, registered nurse, wound care certified, Vice President of Clinical Operations for Swift Medical. So digital wound care management is a point of care application that the nurses and your frontline staff can use to do the length width measurement as well as the comprehensive clinical evaluation. So it's point of care in real time that feeds back to your back office so they can actually see what's going on. It gives you consistent compliance, documentation, compliance week over week, as well as consistency throughout your nursing staff. Some of the core issues that digital wound care management addresses is the inconsistency or the subjectivity that your nurses experience out in the field. The week over week measurements that are inconsistent because one nurse measures head to toe and the other nurse measures max length and width. It gives you control of your documentation so that ensuring that you're in compliance. And it also gives you better visibility into the management level. So you can drive your quality measures, you can reduce your readmission rates, you can increase your institutional referrals at the same time. Digital wound care management addresses pressure ulcers and injuries in multiple ways. One way is that we studied and published on an organization in the southeast of the U.S. and where they actually drove their quality measures by 77% in the positive. So what we saw was over a 6-month cycle of using the solution. They started at 12%. Within 3 months, we're down to 6%, and then after 6 months, we're down to less than 3% in their quality measures. Digital wound care management is important to us now because we're shifting from volume to value-based programs. PDGM is a prime example of that, where we're taking more complex patients, wound care patients in the home care setting. We need to be able to be prepared. We need to be able to take care of these complex patients. So by using a solution like Swift Skin and Wound, you give that clinical accessibility to all your frontline staff.